Awesome. All right, so we're live. I am here with Dr. Burd, founder of Lsyulin, founder of Dexcom, diabetes scientist extraordinaire, and we're both rocking our Lsyulin gear. I'm super excited. It's my brand new shirt. Today we're going to be discussing, we have this segment every Wednesday, and we have different experts on diabetes on this live stream. And the goal is to get people informed, right? Get them information. There's a lot of misinformation out there. And so our goal, our drive, our directive is to get people as much valuable information that can help them live better lives. So Dr. Burd is joining us today. Dr. Burd, I'll let you introduce yourself real quick, and then we'll jump into our topic for today.
Hello, John Burd is my name. I have a PhD in biochemistry, so people can call me doctor if they like. I'm not a medical doctor. I have a PhD in biochemistry, and I've worked developing medical testing products my whole life. And my big claim to fame is that I was the founder and first CEO of Dexcom for people with diabetes. Dexcom is a continuous glucose monitor that means you don't have to prick your fingers anymore to know what your glucose levels are. And the company's been a big success, and there's almost 2 million people now using that product to help them better manage their disease. So in 2017, I started another company, Lsyulin, and it started as a result of an email I got from one of my co-founders at Dexcom. He said, "Why don't you work on something important like glucose toxicity?" And I had never heard that term before, but now I know exactly what he meant. And I'm an expert in it because the reason people get insulin resistance and type 2 diabetes is because of glucose toxicity. And glucose toxicity is because glucose is a reactive chemical. We need it in our body because it generates the energy that we use, and it uses insulin as a hormone made in our pancreas, and it uses insulin to get that glucose into our cells where it's converted to ATP, and that's the activity molecule. That's the good news. That's the angel on glucose's shoulder. The devil is that glucose is a reactive molecule. It's like a poison, and it reacts with all the proteins in our eyes, in our nerve endings, in our kidneys, in our feet. And as a result, it leads to a lot of diabetes complications, and such as, eye problems, which can go as far as blindness, high blood pressure, overweight, kidney problems, wounds that don't heal on your feet because your circulation is so poor, and you get things growing in the wound bed that won't allow them to heal properly. We have another company that has a product for that problem. But as far as that goes for glucose toxicity, Lsyulin is the only product that targets the cause of glucose toxicity. And that cause, as I said, is the reaction of glucose with all the proteins in your body. And we call Lsyulin because it has a high level of lysine in it. Lysine is a natural amino acid. We all have lysine in our bloodstream now, but our body doesn't make it. We have to get it in our diet. And you get it primarily from proteins, because when proteins break down, they produce lysine, which is one of the amino acids that make up proteins. So, but the levels are very, very low. If your blood sugar is 100 mg per deciliter, lysine is only about like 0.4 mg per deciliter. So it's like really, really low. And so it's not there at high enough levels to do you any good. But when you take a Lsyulin supplement, you basically put a lot of lysine in your blood, and that lysine reacts with the glucose, forming glycated lysine. Instead of glycating your proteins, it glycates lysine, and you just pee that away. And it's the perfect way to get rid of all that excess glucose. We kind of use the analogy, it's like a sponge. Lysine soaks up all that excess glucose. So we launched the product in 2018. We launched the company in 2017. We launched the product in 2018 in January. And we didn't really know how well it was going to work. So we did clinical studies, double-blind placebo-controlled studies, and it works great. And there's no side effects like you get with so many of the drugs. And we started out with you had to take 3 large tablets a day. And people complained about the size of those pills. So we came up with a chewable tablet, but you have to take 6 a day of those. And we also have capsules that you have to take 6 a day. We now have a liquid, which is 3 teaspoons a day, a powder, which is just 1 little scoop in a cup of water a day. And now we just recently launched our weight loss meal replacement shake for weight loss and for diabetes management. And we are hoping that'll be a big success. That's for sale on Walmart.com and at Lsyulin.com. Our other products are also available at Amazon, on Amazon. So that was a long-winded introduction to who I am and what I've been doing the last couple of years. And I'm happy to talk about Lsyulin. We're here today to talk about, I think, some other factors relating to diabetes and how Lsyulin can help.
Yeah, absolutely. And thank you so much. I think it's super important for people to know, number one, your background. Obviously, you are a subject matter expert in diabetes care and diabetes science. So I do think that it's important for our audience to understand, where that expertise comes from and how you've applied that expertise to the companies that you've started over the last, 20 and 30 years. Obviously, you've seen a lot of success with the companies that you started. I know people personally who have the Dexcom continuous glucose monitor, who wear it daily, and it has changed their lives. So that is a huge contribution that you've made to the diabetic community. And I think that, it's important to put that in context when we're talking about something like Lsyulin, because our topic today is very specifically other types of supplements for type 2 diabetes that are on the markets and medications that are on the market. We want to kind of dive into that and talk about, the difference between these kind of homeopathic remedies, if you will, that people see. You see the advertisements all over Facebook, all over, anywhere you are online. If you have diabetes, you will be followed by these advertisements. And I see, myself, I'm the digital marketing manager for Lsyulin. And so I'm managing the Facebook ads, and I see the comments that people leave on the ads. There's a lot of mistrust out there. There are, a lot of people who have just desperate for some type of solution, who have purchased these, kind of snake oil supplements that are out there. And we won't, of course, name any names, but there is so much out there that it's unfounded in terms of clinical research. And it's dangerous, truth be told, because number one, you don't know what these side effects are going to be. And number two, if you're taking this alongside other, pharmaceutical medications, there can be contraindications that are dangerous. So I definitely want to dive into that and just talk about kind of the difference between Lsyulin itself and, other types of supplements that are on the market, and what the dangers might be of these homeopathic remedies, if you will, that people are being presented with.
Yeah, there's basically 2 big categories of treatments for type 2 diabetes. If you have type 1 diabetes, there's one treatment, and that is you have to take insulin shots because you don't make any insulin yourself. Or if you take type 2 diabetes, it's what I call a diet disease. It's a lifestyle disease. People will get insulin resistance and type 2 diabetes because of all the carbohydrates we're forced to eat every day in the United States. And it's incredible that the government has that stupid diet pyramid that they put out back in 1980. And it said that you should have a diet that consists of a lot of carbohydrates and a low amount of fat and protein. That is just totally upside down. I believe that we could eliminate type 2 diabetes on the planet if people in the government, the pharmaceutical industry, the medical community would just reverse that table and have people eat a high protein, high fat diet and eliminate carbohydrates. That's funny though. I get emails and talks to people all the time. They say, well, the best medicine is food. Food is the best medicine. If you can get off of carbohydrates, that's the best thing you can do for your health. And they say, well, yeah, but I can't give up my pasta. And whenever I hear that, I always think, well, you got a choice. You can eat bread and pasta and potatoes, or you can you can eat those things and have diabetes, or you can not eat them and not have diabetes. It's your decision. So, and it is your decision. It's not your doctor's decision. You're in charge of your health. Nobody cares as much about your health as you do. So anyway, that's a long-winded story about my hatred of carbohydrates. And it's hard to get off of carbohydrates. I know. I mean, I try to eat very little during the day, but it's difficult. And carbohydrates and processed food is everywhere. When they process food, they take out a lot of the nutrients you need, like calcium, zinc, and vitamin C, which are the three main components in our product Lsyulin. And you mentioned about how there's so many products for people with diabetes. When I started in the medical business back in the 1970s, diabetes was not nearly as rampant as it is today. And you can thank that pyramid, which the government put out in 1980 with recommending high carb diets. And they basically did that because they wanted to support the farmers who grow a lot of grain, corn, wheat, potatoes, rice. I mean, they just wanted to support farmers, so they urged people to eat a lot of it. That was really a terrible recommendation. If you make a graph, let's see if I can get this on this screen here. No, I can't. I was going to say, if you make a XY plot, so you have an XY plot, and then the x-axis is you go from 1980 to 2020, and on the y-axis, if you put people with diabetes, it just shot straight up when they introduced that, and now it's just rampant. It's like an epidemic. Diabetes is killing a lot more people than coronavirus. And if you look at the number of drugs that are available for treating type 2 diabetes, when I started back in the 70s and 80s, there were basically 4 drugs. And now there's over 70 different type 2 drugs. So the pharmaceutical industry is exploiting this disease. And really, the pharmaceutical industries and doctors, they're not particularly interested in curing. They want to keep you sick and hooked on multiple prescription drugs. So if the doctor prescribes a drug, you've got a side effect to it, let me write you a prescription for another drug. So you end up taking multiple drugs and not getting healthy. So it's a terrible situation. And going back to so that's the drug side. Now the supplement story, basically people have been studying all kinds of nutritional supplements for their effect on people with diabetes. And that's in fact how I came up with Lsyulin, because when I thought about glucose toxicity and how we could stop that from happening, I thought, lysine, that's a really logical way to look. And I Googled it, and sure enough, there's some excellent publications that show that it can lower your blood sugar and also stop that reaction between your protein and glucose, and it reacts with lysine, like I said. So it's a totally science-based story. And in fact, I wrote it up as a book, and I called the book "The Natural Solution to the Diabetes Epidemic: The Discovery of Lsyulin." And in there is all the details of how we came up with the formulation. And we now have 6 patents issued on the formulation, clinical studies that prove that it works, and that it helps with improved insulin resistance and improves your diabetes management. And now with our weight loss shake, that's another big problem that people have is their weight, and this can potentially help. It offers you a low-calorie, low-carb meal replacement to take the place of one of your meals. So anyway, historically, supplements have had a bad name because people like me have made big claims, but they didn't have any substantiation. Now, we're the exact opposite of that. We've got 20 years of public science on the ingredients and how they help, and then now we have clinical studies with the product itself that prove that it works. So many of the supplements you see advertised, there's all these things about, as seen on Shark Tank, it's totally a scam. Those things are just, people make that up. I mean, they don't have any substantiation.
It's true.
That's not the case with Lsyulin. You've got proof that it works. I can't get on Shark Tank. I've tried, but they're busy with thousands of other people like me that want to pitch their products to them. So anyway, that's the big difference. And if you look at we have three primary ingredients in Lsyulin: lysine, zinc, and vitamin 3. If you look at some of these other nutritional supplements, some of these things that come from India and other places, they've got like everything but the kitchen sink in there. It's like they got so many ingredients, but they don't have any clinical studies to prove that it works. So anyway, I hope, I really hope that people try Lysol. And I hate it when I hear that people with type 2 diabetes start on insulin. That is a one-way street to drug addiction, because you're going to need more and more and more, and it works worse and worse and worse. And I know that the majority of people with type 2 diabetes, if they take Lysol, they will never have to get on insulin, because Lysol can help improve their insulin resistance and their diabetes and get their A1C down. And actually, relative to that, type 2 diabetes can be reversed. And we have a tab on our website called Reverse Diabetes. And we work with a doctor who has a program in the United States. He's helped thousands of people with diabetes get reverse their diabetes and get off of drugs. So I hope people, if they can't, take a look at that and see what that program is all about. And I like to think of Lsyulin as the company is really a diabetes management company and not a supplement company. So we like to think we're offering people a solution to the problem.
Absolutely. And offer something that has an end in sight, right? Because, and I see this a lot in our group. We have a Facebook group, Diabetes Management and Prevention, Winning Type 2 Diabetes Management and Prevention. And I see people that, come in there and start asking questions that have either been diagnosed with as pre-diabetic or diagnosed with type 2 diabetes. And the questions are always, my doctor tells me that I need to start on metformin. My doctor tells me that I need to start on insulin. Why isn't my doctor offering me this, natural solution? And the truth is because there's a lot of money in the pharmaceutical side of diabetes care, because it's the pharmaceutical industry is not geared towards reversing diabetes. It's geared towards managing diabetes for life, because that is much more profitable than giving somebody a solution that will enable them to get better and get off pharmaceutical drugs.
Yeah, so I've got a story in my book that I'll just give you, which is about the American Diabetes Association, which is a big organization of endocrinologists and diabetes medical doctors. And I wanted to have an exhibit at their annual convention back in 2018 when we launched the product. So I paid them $5,000 for a little 10 by 10 foot table. And a few weeks later, I got an email from them that said, we're refunding your money. You can't exhibit at our convention. And I thought, well, that's odd. What's that all about? And I contacted the organization. They said, yeah, we don't allow supplements to exhibit at our convention. And that's because their conventions are paid for by the pharmaceutical industry. It's really a terrible situation. It's like the foxes in the hen house, or whatever the proper analogy would be, because, pharma just wants to sell drugs and doctors love to prescribe them. And, a lot of people ask, is Lysol and FDA approved? Well, the FDA does not approve vitamins and supplements. So there is no approval to be had with a over-the-counter supplement, but it works.
It does, and we have hundreds of reviews and feedback from our customers who are happy with the product, who are able to get off of. I mean, just on our team within the Lsyulin house itself, we have a couple of people that have type 2 diabetes and whose spouses have type 2 diabetes or were pre-diabetic, and they're taking now Lsyulin. They've seen their A1C levels drop significantly. They're taking the weight loss shake now and losing weight. I just saw an email come through a woman who has been, taking the shake for the last couple of weeks. And I think it was 3 weeks and she lost like 5 pounds. And that is significant if you're dealing with type 2 diabetes or are pre-diabetic, because that little bit of weight loss can help you get to lower, lower A1C levels, if you're changing your diet, if you're changing the way that you are eating in terms of flipping that food pyramid upside down and eating less carbohydrates and eating more whole foods and nutrients that are going to give you, protein and vitamins versus the, kind of empty carbohydrates that people are consuming on a regular basis. Now it can be life-changing. So
actually,
obviously,
the weight loss shake is really a 1-2 punch, because it's literature and studies have shown that low calorie, low carb meal replacement helps diabetes, helps you improve your diabetes management. Now, if you combine that with Lsyulin, which by a whole nother mechanism helps your diabetes management, you've got a really strong combination there to help you improve and get your A1Cs down.
Yeah, absolutely. Yeah, we've got a lot of really exciting stuff coming up in the near future. I know in our Facebook group, we've got actually kind of a test group, if you will. We've got over 1,000 people in there now, I think around 1,200, and it's growing every single day with, this really cool supportive community. And so what we're doing is we have put out a call to action asking for people to work with us to try the shake out. And we've got a great test group that is going to give us their feedback. And so my hope is to be able to get a few of those people on this segment in the coming weeks and the coming months to share their experience, to share their feedback, and, let us know how the weight loss shake is working for them. Because just in the, we just launched it, but just in the last, couple of months, we've seen just some really cool stories. So I'm super excited about everything that we have coming up in the near future for the weight loss shake.
That's great. Thanks, Brianna. It's a pleasure speaking with you.
Always a pleasure, Dr. Burd. I look forward to our next segment. You have an awesome day.
Okay. Thanks so much.
All right. Bye-bye.
Bye-bye.